Imagine someone suddenly collapsing in front of you, motionless, not breathing. People around are frozen, unsure of what to do. At that moment, if you know how to perform CPR, you might be the one to bring them back to life. CPR is a simple yet powerful technique that helps restart the circulation of blood when the heart has stopped beating. It's easy to learn, but its impact can mean the difference between life and death. First, check if CPR is needed. Firmly shake the person's shoulders and place your hand near their mouth to feel for breath. If there is no movement or breathing, start CPR immediately. Lay the person flat on a firm surface and kneel beside them. Place both hands in the center of their chest, one on top of the other, and interlock your fingers. Keep your elbows straight, use your body weight, and push hard and fast. Each compression should press the chest down about 5 to 6 centimeters and then release, allowing it to return to its normal position. As CVO, maintain a steady rhythm of 100-120 compressions per minute. An easy way to keep pace is by saying daka 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 in sync with each push. Continue CPR without stopping until the person starts breathing again or medical help arrives. Remember, there's no harm in giving CPR, but not doing it could be a fatal mistake. Chest compressions keep the blood circulating, which increases the chances of survival. Take the initiative and be brave, because your hands might just give someone a second chance at life. Learning CPR isn't just about acquiring a skill, it's about becoming someone's hero when they need it the most.